Medic Mind. Motivate, mentor, maximize.
Welcome to this video, which will hopefully help you decide what university to choose if you're quite stuck. Now, applying for university when you're applying for medicine can be quite tough because there's so many different factors you have to consider. So now let's go through some of the more important factors now. Now, there are two different learning types you get. You get problem-based learning and lecture-based learning. Some universities are mainly just problem-based learning, whereas others are lecture-based. You also have some universities which have a bit of both, like UCL. So let's talk about problem-based learning for now and the advantages of it. So you can learn by working out a problem and carrying out research individually. Many people argue that problem solving is a lot more engaging than actually just lecture-based training. But some people prefer the actual fact that it's problem-based learning, that you can actually get down to it being like a puzzle, like a game. It really just depends on you. There's a lot more opportunity for group work. If you really like working in teams and sharing the workload with other people, you'll often benefit from problem-based learning. This is especially true if you like working in small groups. Lecture-based teaching is based on a large group of people, so if you really prefer group work, apply to a problem-based learning university. And there is a greater clinical focus. You will work through each section on clinical scenarios and problems. Some argue that this prepares you for being a better doctor in the future. Now, this is the problem with many lecture-based teaching universities because they have a lack of clinical experience in the first few years, and so it becomes a bit more difficult to actually prepare yourself to be a good clinical doctor. But there are also some advantages of lecture-based teaching. Here, you'll be taught whatever you need to know, and in terms of the workload, it will be very much based on the specifics of what is required. With problem-based learning, you may end up learning a lot more than you need to. This is because the lecture-based teaching is taught in 1 or 2 hours, and it will have everything you need to know about that topic. There are huge class sizes. Now, many would argue that this is a bad thing, but it will mean you'll meet lots and lots of people, and every day you'll pretty much be sitting next to a different person. This is really good for things like freshers, where you'll get to meet lots and lots of people. And it is scientific content focused. The content is taught mainly via facts and information. Now, as said earlier, this is good for people who just want to know the bare facts of what you need to know. So with problem-based learning, research is heavily before you apply to one. This is because whilst it may carry a lot of advantages, it requires a certain type of person who is able to study independently and can be put out of their comfort zone. It requires a lot more independent learning, which can be a problem. Now let's look at course structure. You have integrated and you have the traditional. Let's go through the traditional course structure first. This is where there is a distinct split between preclinical and clinical. It is normally a subject-based approach. You focus on the pure theory of medicine, which consists of anatomy, physiology, ethics, psychology, and biochemistry. Now, this is very similar to school, where you have lots of different subjects and are taught in this sort of format. Traditional courses consist of 2 separate parts. You have the preclinical training, which takes 2 years, or 3 years if you do a BSc, and the 3 years of clinical training. St Andrews, Cambridge, and Oxford are 3 of the most traditional preclinical medical schools. So if you're looking to apply to a traditional course, these are the 3 to look for. Then there's also an integrated course structure, where there's a lot more overlap and there is no distinct 1 year where there is more scientific theory than clinical, and vice versa. This is normally a system-based approach. Teaching is based on body systems such as the digestive system. You learn all the anatomy, pharmacology, pathology, biochemistry, genetics, and clinical sciences relevant to that system. For both types, you'll learn the same amount of information, it's just the method in which it will occur. Integrated courses link scientific theory and clinical medicine. The course will still be split into preclinical and clinical, but there will be a lot more overlap. For example, in the first few years, you'll have a lot more patient contact, and it will be a lot more theory-based than your clinical years. So in terms of Medic Mind and what we say to do, my actual preference is integrated because you really get a bit of both. You get some clinical exposure while still sticking to the main routine of learning medicine. You get to meet patients early and develop skills. Now, I find that this is important because to become a good doctor, You can't just be the cleverest and be really good at science. It's a number of different factors. It also shows you the relevance of the scientific theory. So, for example, learning something about the heart and why it's relevant becomes a lot more clearer, I feel, in integrated universities. So with the UCL, it's a lot more integrated because you have vertical modules every Thursday. This is where there's a lot more chance to meet patients and that sort of thing. You also have dissections on Monday as well. So, when you're choosing a new university, there's loads of different factors to consider. Consider the locality. Some people, for example, who are from London, like to apply to London-based universities because they don't want to move too far from home. Some people, it's the opposite. Some people want to try and get as far away as they can from their parents. So honestly, it really matters to you and what you want. The end degree is the same everywhere. Now, this is really, really important to understand. No matter what university you go to, at the end, you'll always become a doctor. Yes, you could argue that some universities have a higher reputation, but with medicine, it's one of the many few careers that with reputation doesn't matter. The only thing really matters is how well you do in your exams. And that will be down not just to the teaching of the university, but to how well you perform in your examinations. PBL learning, remember what I said, it's very, very research heavy, so try and figure out if that's good for you. And dissection's always a big bonus. Another thing I'd recommend is always apply to your strengths. Some universities are more heavily focused on GCSE grades, others A-level predictions, others the 2 examinations, and some others on the work experience and extracurricular. Find out what your strengths are and apply based on this. It's becoming harder and harder to get a place at medical school, so applying to your strengths will really increase and maximum the chance of you getting a place. The Medic Mind online course is being used by thousands of UK CAT students across the UK. For £30, you can access all 150 tutorials in our online course. The course covers 4 full days of UK CAT teaching, as well as a course to help you with your personal statement and interview. You're free to ask as many questions as you'd like to our teachers, and with each tutorial you can read along using our 5 UK CAT ebooks covering 500 pages of theory and questions to guide you every step of the way.